Global stock markets are falling as new cases of the coronavirus are continuing to rise. Billions have been wiped off the value of companies and economies as concerns about the virus continue to mount. The Netherlands, New Zealand and Nigeria have all reported their first confirmed cases. Iran and Italy have seen the number of infections spike. Our first report is from Oscar Valero.
Italy and France, two of the European countries affected most by the virus, organized a high-level meeting to try to calm down to the situation. Something complicated, since Italy on Thursday indicated a big rise in the number of cases. Rome has decided to put 11 cities in quarantine. Other European countries have also reported new cases, and the World Health Organization says it is essential to be prepared.
Every country must be ready for its first case, its first cluster, the first evidence of community transmission, and for dealing with sustained community transmission. These are 4 scenarios. And it must be preparing for all of those scenarios at the same time. No country should assume it won't get cases. That could be a fatal mistake, and quite literally.
But there's better news in China, where fewer new cases are being reported. It's still the country with the highest number of cases, nearly 80,000, and the highest number of deaths. The disease has been confirmed on every continent except Antarctica. Oscar Valero, Euronews.
Worldwide markets are bracing for another day of sell-offs over fears the coronavirus outbreak will disrupt the global supply chain and hit consumer spending. The Dow Jones Industrial Average tumbled nearly 1,200 points on Thursday, and London's FTSE 100 fell by more than 3%. Stocks also plummeted across Europe and Asia, making it the worst week since the 2008 global financial crisis. Well, for more on the market turmoil, I'm joined now by Jamil Andalini from Hong Kong, who's the Financial Times Asia editor. Thanks very much for joining us on Good Morning Europe. Well, there was a little summary there of what's been happening yesterday. Asia markets have again been tumbling today, Friday. How do things look going into the weekend?
Well, we're right now in a situation where we haven't seen markets fall this rapidly or this seriously since the global financial crisis in 2008. In fact, the correction we've seen in the US market over the last 6 days is the fastest ever correction that the US markets have had. So a faster fall in the US markets and the S&P 500 than we saw in 1987 or even in 1929. So we're in a really serious and actually unprecedented situation. And all of this is being driven by fears about the spread of this deadly disease.
Are the markets overreacting? I mean, this is anticipating what really could come next because of all these experts saying that this is a crucial moment.
So I think what's happening is the markets, to a large extent, are playing catch-up. Because, in fact, for the last few weeks, even as this virus raged all the way through China, markets were still assuming that it would all be under control quite quickly and that there would be stimulus measures from various governments, including China, and there'd be a very sharp rebound, even perhaps faster growth than we were expecting this year. But now that we look like we're getting towards a pandemic situation, now markets are finally waking up and saying, actually, this is much worse than we thought.
So what could be the economic impact beyond this, and which sectors in particular are we likely to see hit?
Well, looking beyond the markets, we're talking about every sector you can imagine. Of course, the first impact will be on the travel industry, airlines. We expect to see several airlines go out of business, be bought by competitors. Depending on how long this lasts, it could affect all sorts of other industries as well. Remember, China is really the workshop of the world. It produces basically everything you can think of, at least components of everything you can think of. So if this carries on and China remains under semi-lockdown, you could really see global supply chains start to stutter. A small example, the precursors for many medicines that are made in other parts of the world are actually produced in China, many of them around the area of Wuhan. And because those can't be produced at the moment, or at least exported at the moment, you're starting to see shortages of some medicines in places like the US.
Jamil Andalini from the FT in Hong Kong, thanks very much. Well, Germany has reinstated landing cards for visitors arriving from abroad, even from within the European Union. Jessica Solz is in Berlin. She says it's part of the government's crisis response.
Well, as of yesterday, Germany's Health Minister Jens Spahn has said that he is setting up a crisis team to deal with what he says is the beginning of a corona epidemic in Germany, although he does urge people here not to panic, but just to be prudent. And part of trying to prevent the spread of the infection within Germany is also trying to prevent it arriving in Germany. And that will involve disembarkation cards or landing cards for people arriving in Germany from countries such as Japan, South Korea, China, and Iran, as well as from Italy. Now, people flying into the country, arriving by ship, are legally obliged to fill out these cards. The hope is that if there are any new infections, the government will very quickly be able to tell who was in the vicinity when any infected people were travelling. But for the many thousands of people travelling up from Italy, crossing into Germany's southern borders that way, there's no legal obligation. And in fact, Germany's Interior Minister Horst Seehofer said that he hopes that train companies and bus companies will work with the German government in handing out these landing cards for people arriving by train and by bus, but there's no legal obligation for them to do so. So at the moment, as of this morning, there are 32 confirmed cases of the coronavirus in Germany. These are mostly in the west and the south of the country, but the most recent case is in the northern port city of Hamburg. A paediatrician there broke off his shift yesterday when he recognized in himself symptoms of the virus, and all of the children and the parents of the children he's been in contact with have been placed into quarantine.
Jessica Solz, one of the worst hit countries outside of China is Iran. Officially, there are 270 confirmed infections and there have been more than 25 deaths, although there are questions over the accuracy of the numbers. Friday prayers have been cancelled in Tehran and other cities today, and strict restrictions on foreign imports loosened to allow in face masks, sanitizers and other necessities. Overhead straps have been removed from public transport to stop germs from spreading. Well, there are still many questions about how the virus is transmitted and how it affects people. Here to address some of them, I'm joined now by Dr Michaela Matson in London. Thanks very much for coming on to the programme. There are big efforts going on to fight the coronavirus, obviously. Scientists are working to try to develop a vaccine. Just where are we at the moment?
Well, we're still at the very early stages because this is a new virus, although we know coronavirus is from before. So most effort is done at the moment by small biotech that, starting from the sequence of the viruses, are really trying to design a vaccine around it. But it will take time to test it, and that's the longest and most expensive stages of research. But there is a lot of activity around this.
What problems do the scientists face in trying to develop a vaccine?
Well, it's mostly a race against time, and because, well, it takes time to develop a vaccine, but especially it takes time to test it. And the risk is always that the epidemics is going to come down before the vaccine is ready. For these particular viruses, we face a lot of uncertainties. It's a pathogen that we know very little of, and we don't know even what is the impact on the immune system, on the disease itself. So vaccine designer will have to take all this into consideration before they design something.
And one case that's been in the news has been a woman in Japan who's said to have caught the virus twice. Now, what does that tell us?
Well, it's very difficult to tell what has been going on the information that we have at the moment to know if it's a different viruses. Especially, we would need the sequence taken during both cases. So coronaviruses are RNA viruses. As such, they tend to mutate. However, coronas have also a proofreading mechanism, meaning that they can correct mutation in some circumstances. So it's not one of the most rapidly mutating virus. So it would be a bit surprising. However, as I said, we can't see much. There is, as you mentioned earlier, there are issues with diagnostics as well, because we detect the viral genome, which is a very sensitive and accurate technique, but in certain settings, especially emergency settings, may not work. And actually, there have been reports of underestimation of the number of cases. So it could be a detection, not just error, but maybe picking the virus at the wrong time, maybe when it was low, the viral load was lower, and so the test came out as negative. So it's very difficult at the moment to tell if it's a new infection or if it was a different time of diagnostic. But it's definitely something that we would have to keep an eye on. There have been reports in China as well of cases that were reported negative and turned out to be positive. So again, we don't know if it's diagnostic or if it's something else. But yeah, we shouldn't panic about it.
That's something that's reassuring anyway. Dr Michaela Matson from Virology Research Services, thanks very much for joining us.